like to invite our third speaker, Dr. Joan Reed, who is the inaugural Dean of Diversity and Community Partnership, and also a Professor of Medicine at Harvard Medical School. Please.
So thank you, and hopefully you can see my screen. Can you see it?
Yes.
Okay, wonderful, thank you. In looking at these three questions, and in listening to all of the speakers who preceded me, I'm going to be capturing lots of what has been said. It's been absolutely wonderful. And I'm going to be coming back to these issues of intentionality and accountability. But in being asked to sort of start my own journey towards leadership, I decided in seventh grade that I actually wanted to be a doctor. And for those on the call or who are in this meeting, who may remember from the past the days of Dr. Kildare and Ben Casey and all of those kinds of individuals, they were programs that I saw. And for me, what I saw was people in leadership who were making decisions, who were making change. And it never occurred to me that they were white. It never occurred to me that they were all men. What occurred to me is that they were in charge of their world. And so I decided at that time I wanted to be in charge of my world. Didn't think of it as leaders. It was having that influence and being in charge in that space. Now, it wasn't because I came from a family that's what I saw. However, I saw these amazing, strong Black women who took care of their family, took care of their community, and had this unfailing belief in possibility, and that you should be devoting yourself to helping others. And they were the backbone that held me up. It never occurred to me that I couldn't or shouldn't be a doctor. And as I look forward to my career, as I looked from high school, where I started tutoring students, and I was doing my physics and my chemistry work at MIT, because I had access to the computers there. If I look at Brown, where I went to college, accepted at Pembroke, went to Brown, but got there because I ignored guidance counselors who told me that someone like me could never get in, and I only applied to that one place. But there started tutoring. And then on to medical school, Mount Sinai, and at Brown was a biochemistry major in the chemistry department. Mount Sinai Medical School, where I was again teaching, and then Hopkins for residency. If I look through my entire career, it was always related to education, although I never realized it early on, and always in this space around social justice and equity. And that has driven me to where I am now and the work that I do today, which is really about how do you open the windows, open the doors, let people in the room, let people have a seat at the table, people who look like me. But much more important for me, it's not just that seat at the table. How, when you're there, can you have a voice? Can you be a part of the dialogue? Can you be part of the deliberations? Can you move to a place where you're inviting others in, where you're setting the agenda, where you're actually leading? And so with that as a backdrop, I think about what are some of the challenges in this space. And the presenters before me have talked about some of these barriers that are at the individual, organizational, or societal level. But I think about what we see, and some people have referred to some of the articles, but the difficulty in terms of getting published. And there was a recent article that came out about health equity tourism. The issues around getting R01 and research funding, the issues around having research that relates to health equity and those types of issues and health disparities actually getting funded and not funded by study sections and reviews. Issues around being represented in conferences and speaking and leading and on panels. The ways in which the system has served as a block. But I also think in terms of what has been discussed here in terms of those barriers around stereotype and stereotype threat, this sense of isolation and exclusion and being both invisible and hypervisible where we sit. these expectations of service that are under-resourced and not valued by our institutions, the microaggressions, the bias that we experience when we are individuals who are different, when we, because of our race, ethnicity, et cetera, and also think about this intersection and this intersection of oppression. And here's some work that came out of the Institute on Women's Policy Research that was in this AAMC report. And what struck me, and they're talking about this parity and saying it'll take 40 years, 2059, for women to finally reach pay parity, but Hispanic women, 2,224, and for Black women, 2,130. And so there are these multiple intersecting issues that are impeding moving forward. When I think about this, and I think about this space about leadership, I think about these cumulative ways in which discrimination impacts us. And some of the strategies, and this is really taken from the National Academy Report on Promising Practices for Addressing the Underrepresentation of Women in Science, Engineering, and Medicine. Some of those individuals who are involved in that are speaking here today. It's about identifying promising candidates, it's expanding networks and not looking in the same places that we've always looked for individuals. It's about thinking about the requirements and the metrics on which people will be judged and what we prioritize. It's about holding individuals accountable for the outcomes of these searches and these processes. It's about providing structure that will mitigate bias. It's about education about bias and tracking. But all too often, we stop at the recruitment and we don't deal with the issues of individuals who've entered our institutions in terms of their advancement and their movement towards leadership. And in this fog about what are the clear metrics for success and advancement. Again, from this same kind of report, what are the criteria? What are the skill sets that are required, not just personality issues that people talk about? And are there multiple ways to demonstrate accomplishment? And how, as our institutions are looking at modifying their missions and value statements to talk about equity and diversity, how are those valued and recognized and rewarded within our institutions in terms of promotions or in terms of awards, in terms of performance reviews? As we look across our institutions, our professional associations, et cetera, how are women and BIPOC individuals actually nominated? And not just being nominated, actually receiving awards. How are they represented in the committees that make those decisions? What about the issues of their embedded structural bias about who gets funded, what they get funded to do? Part of that I've already alluded to. Who gets sponsored to be on the committees, on the task forces, to have their names put forward? And to what extent are we creating cultures in institutional environments that are inclusive and respectful? Again, we're going back to some of the themes that were mentioned by Lydia and Gilda, David and others around not expecting the individual to be responsible for this change, but how is the organization and the institution responsible? And we've talked about, and Susan has talked about some of the programs that I've had that really are looking at this pipeline and opening this space. I want to turn to another part of this leadership. And it's another program that I want to use as an example, and it's a Commonwealth Fund Fellowship in Minority Health Policy. And it's a program that was designed to say we need more leaders in this space that can create change in systems. And so it's not leaders for leaders' sake, but that can be in places, have seats at the table, be in positions to create substantive change and counter assumptions about there's nobody there, there's a lack of interest. They really don't have the potential, how do they really get into this place? The hidden paths to leadership and understanding how people arrive and the importance of relationships and networks, and actually the lack of preparing people. And so this has three major goals. It's about preparing physicians. There's also a comparable fellowship program for dentists to improve health of vulnerable populations. It's about representation across multiple sectors. And it's this idea of a continuum of advancement. And here I want to say that all too often when we think about leadership, we think about entry leadership. And I want us to think in terms of, or I think of in terms of as careers and moving up through stages where you are maybe in a single domain, in a single space leading, but as you grow, as I think about the individuals who've spoken so far, expanding that domain in terms of the skills that are required and moving from this technical space, increasing interpersonal skills where you really have to um, manage others in order to advance into these strategic spaces. And how do we make sure that we're advancing diverse individuals across this full spectrum, across the board? And with this in mind, I'm trying to advance this, sorry. The Commonwealth Fellowship has degrees at the School of Public Health or Kennedy School of Government at Harvard, and these are what I would call these skill sets about economics and biostatistics and the healthcare system, all clearly important in this space. But I want to talk about another set of skills that has been alluded to in some of the other presenters that we often leave out. And here I want to talk about these social competencies and these organizational competencies. And this is oftentimes what trumps up individuals as they're moving forward. This cultural knowledge of communication skills and styles and how you are accepted, not accepted, and what are the rules of the game. Cultural inclusion, this self-evaluation and self-esteem, self-efficacy, understanding self within the system, within the organizations. What are the written and unwritten rules? If you think about the iceberg, that 10% of the rules above the water, and that 90% below that can make or break you. It's this positioning, and as our individuals are moving forward, are they having the mentors, the sponsors, the coaches, the individuals that can strategically help them know when to say in yes and no, help them not become that individual who only shows up on the brochure or the billboard as a symbol, as I heard David talking about collectors, et cetera, and really position themselves into places where they can move forward and have increasing influence. It's about how you brand oneself, you promote yourself, you assert oneself, and think about your career path and going multiple directions. For me, this is the Commonwealth Fund Fellowship. We're now at over 150 fellows. 100% have remained engaged in policy and research and service delivery. 80%, roughly 80%, have academic appointments in schools of public health and or medicine. Multiple awards and honors, more than 1,000 publications, multiple advisory committees, boards on national level, and positions of leadership in multiple sectors and spaces. And so what you see here are individuals from the federal government and the head of Office of Minority Health, DHHS, head of PCORI, at the state level, past Commissioner of Public Health in Massachusetts, at the city and more local level, the director of the Department of Health for DC, really across the board in the academic environment, the chair of OBGYN at Brigham and Women's. You're seeing individuals who have been helped to be prepared to move into leadership positions and to rise in those positions. And so for me, it was this amazing moment last week when 2 fellows from this group were inducted into the National Academy of Medicine. And so it's not just entry into leadership, but it's rising in leadership. And so for me, what is it about? It's about recognizing potential and having this growth mindset. It's about building confidence and skills, multiple skills, giving feedback that is critically important and oftentimes people of color don't get, and providing real support, not just verbal support, giving the time, funding, training, networks that can move people forward, and this importance of mentors, coaches, sponsors. For those individuals, for me in an academic environment, our faculty and fellows, this need for professional development, it doesn't just happen by sitting in the room. Access to opportunities and networks and emotional support, it can be hard. Building a sense of community and communities because we have multiple identities and accountability for utilizing the resources that have been brought to bear. Helping them to deal with the institution and politics of an organization and sponsoring them in that, and a safe space. in this mentoring, it's really understanding the needs that they have coming from different backgrounds and different journeys. What I heard today were very different beginnings and paths to the leadership positions that the speakers have held here today. So how do you assess the needs at different points in one's career and along these different paths? Providing some structured learning experiences, building networks of support, making sure that they have access to the information that's needed, this democratized knowledge that tends to be held by a few as they move forward, and then sponsor. And this is from an article by Chow, who talks about this ability of those in leadership. And I turn back to the last speakers, thinking about our roles as we have moved into a space where we can sponsor and to be able to talk about these young leaders who are coming along, about their achievements and accomplishments, to underwrite them, to use our own legitimacy to help others to understand that they're worthy of investment, and to facilitate them meeting others and making the connections that they need. And all too often, being willing to step in to challenge others' beliefs and attitudes about individuals, why they're there, how they got there, and what they're capable of doing. Undoing the negative perceptions and turning them into positive. When I think about my career, it's those mentors and sponsors who have amplified and boosted and connected and defended me, who have been in places to help make sure that I could stay the course and move into the position that I'm in now. Thank you.